Welcome to Integrative Medicine Perspective. I'm Dr. Wendy Liu. Today we're going to talk about antioxidants again. This is because one of our viewers suggested that I read a news report published on Science Daily. This news report originated from the Karolinska Institute in Sweden. This article discusses a study led by Dr. Burgle's research team, which found vitamin C and other antioxidants can stimulate the proliferation of blood vessels in lung cancer tumors, thereby promoting cancer growth and metastasis. The viewer suggested that I discuss the article's implication on clinical practice. Well, first, the article is a news report. Secondly, it is not a clinical trial. So it will unlikely have a decisive impact on clinical practice. However, the study finding mechanistically explained some negative effects observed in clinical trials of antioxidant use in cancer prevention and treatment. And the content discussed in this article aligns with the current standard and guidelines for clinical practice. I have previously discussed about the negative effects of antioxidant use in cancer prevention and treatment. So I will put the links to my previous videos below. I strongly agree with the message in this news article that while there's no need for us to take antioxidant supplements, especially in high doses, there's also no reason for us to fear antioxidants present in our foods because there's a big difference between obtaining antioxidant from real foods and relying on supplements. I have previously mentioned a systematic review suggesting that diets rich in beta carotene and vitamin A have cancer preventative effect. However, subsequent large clinical trials found that beta carotene and vitamin A supplement increased the lung cancer risk in smokers. On the surface, it appears that the results of those large clinical trials contradicted findings from previous epidemiological studies. But if we think this through, these two researchers were actually not addressing the same subjects. While both researchers used beta carotene and vitamin A as nutritional indices, the epidemiological research referred to obtaining beta carotene and vitamin A from real foods. So if we used the intake of vegetables as the nutritional marker in those epidemiological studies, we would have concluded the same anti-cancer effects. But the beta carotene and vitamin A used in those large clinical trials were isolated compounds, not representative of any dietary pattern. The distinction between diets rich in beta carotene and vitamin A and isolated compounds is enormous. So the true difference between these two researches is not about their contradicting findings, but rather about different research subject. One research was talking about the diet, the other medications. So we have learned valuable lessons from those two large clinical trials. They remind us of the importance of truly and accurately understanding and interpreting epidemiological findings or any other experimental results. Now let's get back to why we shouldn't fear antioxidants in our foods. This is an epidemiological survey about the diet and health of the American population. This article used data from 1999 to 2010. Data analysis showed that sufficient intake of vitamin A, vitamin K, magnesium, zinc, and copper was associated with lower mortality rates. But this correlation was limited to nutrients obtained through real foods only. There was no such correlation with nutrients obtained in the form of supplements. On the contrary, daily calcium supplementation exceeding 1,000 milligrams was associated with a more than 50% increased risk of dying from cancer compared to those who did not take calcium supplements. This survey result is consistent with previous epidemiological report. This article also reminds us that the effects of food and isolated nutrients on our health are different. Now, let's take a look at the beneficial diet suggested by this survey. The diet can provide adequate vitamin A, vitamin K, magnesium, zinc, and copper. We know food sources for vitamin A, vitamin K, and magnesium are mainly plant-based, but food sources for zinc are mainly animal-based. We can obtain adequate copper from both plant-based and animal-based foods. A diet that can provide adequate intake of all these nutrients has to be plant-based and with a wide variety of foods. So it is worth emphasizing again, real foods can provide us complete and balanced nutrition, while isolated nutrients cannot. I do not advocate relying on multivitamin for the same reason. Multivitamin is just that, multiple. It is far from being complete and balanced. That's all for today's discussion. Please leave comments and questions. I will see you soon.